Welcome to Minds Through Time, a 7-part YouTube series exploring the fascinating history and psychology of mental disorders. In this series, we will delve into the evolution of our understanding, diagnosis, and treatment of various mental health conditions. Today, we will begin our journey with major depressive disorder, tracing its roots from ancient descriptions of melancholia to modern perspectives on depression. So, let's dive into the complex history of the pervasive mental health issue. Our story begins in ancient times, where the concept of melancholia was first introduced by Greek physicians like Hippocrates. Melancholia derived from the Greek words melas, black, and chole, bile, was believed to be caused by an imbalance of bodily fluids or humors. This theory persisted for centuries, influencing the approach to treating depression and other mental disorders. As we move into the earlier modern period, prominent philosophers and physicians like Robert Burton and Thomas Williams continue to explore melancholia. In his influential work, The Anatomy of Melancholy, Burton described depression's diverse symptoms and potential treatments. During this time, the focus began to shift from an imbalance of humors to a more complex interplay of psychological, social, and biological factors. Fast forward to the 19th and 20th centuries, where groundbreaking work by figures like Sigmund Freud and Emily Kraepelin advanced our understanding of depression. Freud's psychoanalytic approach emphasized the role of unconscious conflicts and childhood experiences, while Kraepelin categorized depressive episodes as part of a broader manic-depressive insanity. These ideas laid the groundwork for modern diagnostic criteria and treatment approaches. The publication of the Diagnostic and Statistical Manual of Mental Disorders, or DSM, marked a significant turning point in the history of depression. The DSM has gone through several revisions since its first edition in 1952, each refining the criteria for major depressive disorder. Today, depression is diagnosed based on a combination of emotional, cognitive, and physical symptoms, emphasizing the multifaceted nature of this condition. Throughout history, treatments for depression have varied greatly, from bloodletting and exorcisms in ancient times to earlier 20th century methods like electroconvulsive therapy and psychosurgery. The advent of antidepressant medications in the 1950s revolutionized depression treatment, with drugs like monoamine oxidase inhibitors and selective serotonin reuptake inhibitors, offering new hope for those suffering from this debilitating condition. Today, treatments also include evidence-based psychotherapies like cognitive behavioral therapy and interpersonal therapy, which can be effective alone or in combination with medication. As we've seen, the history of major depressive disorder is a fascinating journey through time, reflecting humanity's ongoing quest to understand and alleviate suffering. From melancholia to modern diagnostic criteria, our understanding of depression has evolved immensely, shaped by cultural, philosophic, and medical perspectives. Join us in the next episode, where we will explore the history of anxiety, from ancient notions of nervousness to the contemporary understanding of generalized anxiety disorder. Thank you for watching, and don't forget to subscribe for more insights into the captivating world of mental health history.